Welcome back, guys. My name is Dr. Lane Tran at Fastlane Sports Therapy, and today we are going over how tissues are injured in the knee now when performing a heel hook. So here we go again, diving right into it. So here we have the glute max and the hamstring. So we're going to go over the glute max first. So the glute max, its primary motion is hip extension. So when you're performing a heel hook, you have hip extension and you want the hip to take the brunt of the forces. So if someone weighs, let's say 100 pounds and they're doing a heel hook, moving 100 pounds on the wall, you want the hip to activate first, to contract first, to take up as much of the 100 pounds as you can before moving to the knee. Because if we have just the hamstrings contracting here, and let's say the long head of the biceps right here, so what this guy does here is also hip extension, as you can see here. So it assists the glute max and hip extension, and then it also does what we've shown before is knee flexion. So we can dump 60 to 70 pounds into the hip first versus dumping 60, 70 pounds into the knee first. We protect the knee because the bigger musculature and the bigger hip joint right here is able to take on more of the forces and distribute it more evenly throughout the hip versus dumping all that weight into the knee, which has a lot of excess torque being pulled from these muscle groups right here. So when performing a heel hook, we want the glute max more engaged along with the hips, essentially posterior pelvic tilting. What that means is if you had a belt on, you want to imagine pulling that belt buckle up, pointing towards the sky. So you get in the hip extension, pelvic tilt first before we get that knee flexion. And then we're going to go into more on the wall, essentially what vectors go into which direction, how that knee is injured in a second right here. Alright guys, we're back with the force vector kind of image here. So essentially this is a knee, of course, and imagine this is the rock that you're digging into on the wall, whether indoor or outdoor. And so these are some of the force vectors that are occurring. So when someone is pulling with their hamstring and glutes, they're pulling here on the hamstring tendon, and then that's also pulling on the PCL. Remember before, from the video before, the PCL limits the amount of translation that your shin bone, your tibia here, can slide backwards. So we're tugging on the PCL one way. And now the rock, as Newton's third law states, or second law, for every action there's equal and opposite reaction. The force pushing back is the rock on the wall and is putting forces going back through the ACL this way. And before we stated the ACL limits the amount of anterior translation on the knee, so the amount of the knee can slide forward. So here we're having two force vectors pulling on one another, and if one of those either gives, then you're going to have some injuries to the meniscus inside. Remember when that femur slides on that tibia or tibia slides on that femur, and you're also going to have injuries to the joint capsule, which is all encompassing this area right here. So this is one of the structures, again, that can be injured: the tendon, the PCL, you have the ACL, joint capsule, and then the meniscus as well. And then if we fast forward through here and we go towards the image here that you see is the kind of a frontal plane image. So you're looking straight at the knee right now. Its knee is bent. So right here, the straight line shows what the LCL and the MCL are right here. So when you have a force pushing in or out, or if the knee rotates in or out, this curved line is shown here. It's a little exaggerated, but that's essentially what happens to your MCL and LCL. So these two ligaments on the side can also bend and twist and be pushed one way or another, taking up slack in there, and ultimately they have a breaking point as well. So again, this is another two structures that may be injured, your MCL and your LCL. Tune in next time, guys. We're going to tell you how to rehab it.